Good morning students, I am Vijay Swargis, lecturer of Emmanuel Asser College of Pharmacy. Today we are going to see about clinical pharmacy. Then first one, outlines of clinical pharmacy, introduction to clinical pharmacy, concept of clinical pharmacy, functions and responsibility of clinical pharmacist, drug therapy monitoring, medication chart review, clinical review, pharmacist intervention, wardrobe advisors, medication history, pharmaceutical care. The last one is a dosing pattern and drug therapy based on pharmacokinetics and disease pattern. Then first one, introduction to clinical pharmacy. What do you mean by clinical pharmacy? Clinical pharmacy is a branch of pharmacy that involves the provisions of patients' care with the use of medication to optimize the health outcomes of patients. Then clinical pharmacy is mainly focused on treating illness and preventing diseases in the patients. Clinical pharmacy is mainly focused on treating illness and preventing diseases in the patients. Then clinical pharmacy practice is concerned with the promotions of safe, effective and economical drug therapy. This includes promoting wellness and preventing disease. Then the practice of clinical pharmacy is a pharmaceutical care psychology, philosophy. Furthermore, it combines patients' care with specialized therapeutic knowledge about the use of medicines. It follows the idea of pharmaceutical care, which means the pharmacist is responsible for encouraging that medicines are used safe and effectively. Then clinical pharmacy is defined as the service provided by pharmacists to promote rational drug therapy that is safe, appropriate and cost effective. Clinical pharmacy is the branch of a pharmaceutical science. Then clinical pharmacy involves a short notes, providing direct patient care, ensuring safe and effective use of medicines, applying therapeutic knowledge to improve patient health and prevent disease. That is the short notes of the clinical pharmacy. Then next topic is why clinical pharmacy is required. Why clinical pharmacy is required. Then first one, increased number of pharmaceutics drugs in the market. Market available in increased number of pharmaceutics drugs market. Then increases in patient numbers. Third one, increase in the comorbidities, means presence of more than 2 diseases. Then increase in the rate of hospitalization. Then increase the rate of the death. Then complex treatment, prescription condition, more drug related problems. Doctors are too busy to explain about the medicine to the patients. Explain to the medicine to the patients. Then next topic is concept of clinical pharmacy. Clinical pharmacy started becomes hospital had pure medicines control system in the early 1916s. Clinical pharmacy started because hospital had pure medicines control system in the early started 1916s. Then other point, the emergence and need of clinical pharmacy as a form of a practice has been attributed to the pure medicines control systems that existed in the hospital during the early 1916s. The next one, there were problems in how medicines were used, stored and monitored, which created a need for the improvement. Then third, both the USA and UK faced similar hospital problems, but they developed different approaches to solve them. In the 1918, clinical pharmacy developed more because it helped in the improving medication safety than other Promoting cost effective use of medicine, using the best medicine at the lowest cost. First, improving medication safety and promoting cost effective use of medicines. Then clinical pharmacy, due to the presence of pharmacists in the patient care areas and their insert in ensuring safe and proper use of medicines. Proper use of medicines. Then short explanation. Origin early 1916 due to pure drug control system. Pure drug control systems. Growth 1918 focus on the safety and effectiveness of cost. Cost effectiveness. Focus on the safety and cost effectiveness. Then key rules. Safe use of medicines and rational and economical therapy. Safe use of medicines and rational and economical therapy. Reasons for emergency. Involvement of pharmacists in the patient care. Need to improve medication practice. Improve to the medication practice. Then clinical pharmacists practice in the healthcare settings and utilize in-depth knowledge of medication and diseases state to manage medication therapy as part of a multi-professional team. There are primary sources of scientifically valid information on the safe, appropriate and cost-effectively use of the medications. Clinical pharmacists are responsible and accountable for medication therapy and patients' outcomes. Then next slide is discuss about functions and responsibility of clinical pharmacist. Functions and responsibility of clinical pharmacist. Then first point is compound and dispense prescriptions. Compound and dispense prescriptions. Then conduct medication history interview. Conduct medication history interview. Then explain how to use medicines. Explain how to use medicines. Explain how to select medicines for doctors. Explain how to select medicines for doctors. Monitoring drug therapy. Conduct patient counseling. Drug information service. Identify, document and reporting ADR. ADR means adverse drug reactions. Conducting patient educations. Prepare treatment guidance. Involved in education and training activities. Involved in education and training activities. Participate in the research activities. Medications. Improving medication adherence. Improving medication adherence. Avoid drug related problems. There are the functions and responsibility of clinical pharmacist. Then repeat. Compound and dispense prescriptions. Conduct a medication history interview. Explain how to use medicines. Explain how to select medicines for doctors. Monitor drug therapy. Conduct patient education. Conduct patient counseling. Drug information service. Identify, document and reporting adverse drug reaction means ADR. Prepare treatment guidance. Involve in education and training activities. Participate in research activities. Then improving medication adherence. Avoiding drug related problems. Then the principal activities of clinical pharmacists includes consulting. Consulting means analyzing therapies, advising healthcare practitioners on the drug therapies and providing pharmaceutical care to patients both at hospitals and community levels. Then second one, selections of drugs. Selections of drug defining drug formularities or limited list of drugs in collaborations with the hospital, doctors, general practitioners, general practitioner and decision makers. Then third one, drug information. Drug information, seeking information and critically evaluating scientifically literature, organizing information service for both the healthcare practitioner and the patients. The principal activities of clinical pharmacists includes consulting, selections of drugs and drug informations, and formation and preparation, drug use studies and research, pharmacovigilance and vigilance in medical device, clinical trials, pharmacoeconomics, dispensing and administrations. And this is the functions of the responsibility in a clinical pharmacy. Then next, formulation and preparation. Formulation and preparation of medical product and device according to acceptable standards to meet a specific patient's need. Then drug use studies and research. Drug use studies, pharmacoepidemiology, outcome research. Then pharmacovigilance and vigilance in a medical adverse. Collecting data on the drug therapies, their cost and patient's outcome through structured and scientific methods. Clinical trials, planning, evaluating and participating in a clinical trials. In pharmacoeconomics, pharmacoeconomic means using the result of clinical trials and outcome studies to determine cost effectiveness evaluation. Dispensations and administrations. Dispensations and administrations of medicinal product and devices. Then repeated, functions and responsibility of clinical pharmacist, consulting, selections of drug information, formulation and preparation, drug use study and research, pharmacovigilance and vigilance in a medical device and clinical trials, and pharmacoeconomic and dispensations and administrations. Okay. Then next slide we are discuss about drug therapy monitoring. Drug therapy monitoring means on the healthcare team, the pharmacist is a key member who provide ongoing drug therapy monitoring. Ongoing drug therapy monitoring. On health care team, the pharmacist is the key member who provides ongoing drug therapy monitoring. Pharmacists have the skills and knowledge to perform and emerence the rules. Drug therapy monitoring is an ongoing process in which pharmacists actively review patients' records, identify and resolve drug therapy problems such as adverse drug events, and communicate with the prescriber when a problem occurs. That means the drug therapy monitoring. Pharmacists educated patients and their caregiver about potential adverse effect and work within patients to ensure adherence to their and therapeutic goals. That is a drug therapy monitoring. Drug therapy monitoring should be routine but is not always done continuously or systematically. Drug therapy monitoring should be a routine but is not always done systematically. Medication monitoring is optimized by a team approach that includes a pharmacist. Then Patient details, name, age, weight, histories, medications. Then schedules means when to review lab visits and clinical responsibility. Patient counseling means diet, herb interactions, what to report. Follow up means next checking in the data adjustment made. That is a monitoring pharmacist means parameters means efficiency signals, sign and symptoms, symptoms improving, target levels. Then safety labs means example for INR for warfarin, glucose for insulin, then etc. Adverse effect of the uh, adverse effect then following are the three steps of monitoring. Following are the three steps of monitoring. Educated patients about their therapy, potential adverse effect and actions to take if problems occur, make patients activity practitioner in the medication management and their own health decisions. Regulatory access patients, drug therapy ensure that patients take their medications as prescribed, proactively identify and resolve adverse drug reactions and they occur, and access therapeutic effectiveness, ensure that appropriately labs are done and assigned. Then third point, adjust drug therapy as need based on monitoring process. On monitoring process. Following are the three steps in the monitoring. Then flowchart will be medication chart review, daily medication schedules, patient's name, date, allergies, personal medication records, name, pharmacy, physicians, then flowchart for daily medication schedules, medication chart review. Medication chart review, it is the fundamental responsibility of a pharmacist to ensure the appropriate of medication order or medication order. It serves as a starting point for other clinical pharmacy activities, medication counseling, drug information, TDM means drug information, and ADR means adverse drug reactions. Organizing information according to medical problems. Medical problems helps break down a complex situation into the individual parts. Medication chart reviews. Then goals to optimize the patient drug therapy. To optimize the patient drug therapy. To prevent or minimize drug related problems, medication error. To prevent or minimizing drug related problems, medication error. Medication chart review procedure. The patient's medical records should be reviewed in pairing with the medication administration record. Recent consultation, treatment plans and daily progress should be taken into account when determining the appropriateness of current medication orders and planning each patient's care. Then all the patients' recent medications order should be reviewed. All presents and the recent medication order should be reviewed. Then medication chart review procedure, so 3 points. Then components of medication order review. Components. Checking that medication order is written in legal and local requirements. checking that medication order is written in the legal and local requirements, ensuring that the medication order is understandable and understandable, that is approximately terminology is used that the drug name are not up to stated and noted the chart to provide clarifications as required. Detecting order for medication to which the patients may be a hypersensitivity and intolerant. Dedicating orders for medication to which the patients may be a uh, hyper hypersensitivity and intolerant. Then ensuring that the medication order is appropriated with respect to the patient's previous medication order. First one, the patient's previous medication orders. Second, patient specific consideration. Example, disease state and pregnancy. Second point, patient specific considerations. Example, disease state and pregnancy. Third point, drug dose and dosage schedule, especially with respect to age, renal function and liver function. Drug dose and dosage schedule, especially with respect to age and renal function and liver function. Routine dosage form and method of administration. Then ensuring that medication order is respected to 4 points: the patient's previous medication order, patient specific consideration, example disease state and pregnancy, then drug dosage and dosage schedule, especially with respected to age, renal function and liver function, then dosage form and methods of administration. Then other slide we are clinical review. What do you mean by clinical review? Clinical review means is one of the important component of the medication review and should probably be performed on a daily basis. Clinical review is one of the important component of medication review and schedule properly be performed on a daily basis. It is the review of the patient progress for the purpose of the assessing and therapeutic outcome. The therapeutic goal for the specific disease should be clearly and identified before the review. Then goals of clinical reviews. The primary aims of the clinical reviews are assess the response to drug treatment, evaluated the safety of the treatment regimens, assess the process of the diseases and the need for any changes in therapy, assess the need for monitoring if any, assess the conversations of therapy to improve a complaints. Pharmacist intervention means the role of pharmacist has been dispensing medications to patient here, patient counselor, healthcare educator and community service to health practitioner. Then interventions by the pharmacist have always been considered as a valuable healthcare community in the patient's care process, reducing the medication error and randomizing the therapy and reducing the cost of therapy. Then pharmaceutical interventions as a pharmacist is responsible to drug related problem in an individual patients occurring in any phase of the medication process. Then drug related problems is pharmacist interventions. Objectives need for pharmacist innovations. First one, reduce healthcare utilization and cost. First one, reduce health care utilization and cost. Then second one, provide evidence based information. Provide evidence based information. Provide evidence based information, second point. Third, provide what type of pharmacist interventions increase medication adherence and reduce healthcare utilizations and by how much. Objectives need for pharmacist interventions. First one, reduce healthcare utilizations and cost. Then provide evidence-based information. Provide what types of pharmacist interventions increase medication adherence and reduce the healthcare utilizations and by how much. Then importance of pharmacist interventions: decreasing healthcare cost and utilization. Decreasing healthcare cost and utilizations. Medication adherence, patients complaints. Then patient educations, effective communication and establishing patient relationship, medication therapy management, beginning a member of healthcare teams. Then importance of pharmacist intervention. Then first one, decrease in healthcare cost and utilization, medication adherence in the patient complaints, patient educations, effective communication and establishing patient's relationship, medication therapy management and beginning a member of a healthcare team. Beginning of a member of the healthcare team. Then next topic is ward round participation. Ward round. What do you mean by ward round? Ward round means, ward round are the routine clinical rounds. Ward round means routine clinical rounds, where the health provides visit the patients in the ward to assess the progress of the health conditions of the inpatients. Patients' health conditions, visiting patients health conditions, inpatient checking in the clinical rounds, ward round. The doctor-led ward round comprises of the unit of the medicines or any other specialties where the professionals, associate professor, assistant professors, senior residents, postgraduated and interns along with the pharmacist and nurse observe the patient's conditions and access to decide further therapeutics for the patients. Then ward round participation. The doctor-led ward round comprises of the unit of medicine or any other specialties where the professor, associate professor, assistant professor, senior assistant, postgraduated and interns along with the pharmacist and nurse observe the patient's conditions and access to decide further therapeutics for the patients. Then pictures, word pictures is shown. Then goals of the ward round participations. The goal of the ward round is to closely monitor the patient's conditions and take immediately interventions to improve the patient's conditions and avoid health. The doctors are visiting all the patients admitted in their unit in an order beginning from intensive care unit. Here also there is a documented case reported to remind the case history of the patients who quickly updated and is available to change the treatments. Then goals of the ward round precipitations. Then rules of pharmacist in ward round precipitations means the pharmacist beginning and experted in the matters of drugs should be available for the ward round team to decide upon the matters of dosage, remains, formality, interpenetrations, ADR monitoring means drug adverse drug reaction monitoring, drug-drug interaction, drug-food interactions and drug and poison information services. and drug and poison information services. The availability of pharmaceutical services identify enhance accuracy of treatment, patient safety and efficiency. Patient safety and efficiency. Then objectives of the ward round patients. The ward team comprises of doctors, nurse and pharmacists who work in the team with a common objective to ensure safe, effectively, economic and patient-friendly treatment with the knowledge inputs of the each professional practice. Each professional's practice. Then medication history means a medication history is detailed, accurate and complete account of all prescribed and non-prescribed medications that a patient had taken or is currently taking, instructions or ambulatory care. It provides valuable insight in the patient's allergic conditions, adherence to pharmacological and non-pharmacological treatments, and safe medication with complementary and alternative medications. Interviewing a patient in collecting the data, medical history is called a medication history interview. Then medication history means a medication history is a detailed, accurate and completed account for all prescribed and non-prescribed medications. Then pharmaceutical care. Then other topic pharmaceutical care. Pharmaceutical care means defined as the responsible provision of drug therapy for the purpose of achieving definitive therapeutic outcomes that improve the patient's quality of life. The pharmaceutical care means the responsible provisions of drug therapy for the purpose of achieving definitive therapeutic outcomes that improve the patient's quality of the life. Then outcomes are cure of the diseases, elimination or reduction of patient symptomology, then arresting or slowing of diseases process, then preventing of diseases and symptoms. Then outcomes are for cure of the diseases, elimination or reduction of patient symptomology, arresting of slowing of a diseases process, then preventing diseases or symptoms. Then basic elements of pharmaceutical care. Then first one, patient originated. Second, both acute and chronic problems addressed. Both acute and chronic problems addressed. Third, stress and preventions of drug related problems. Stress on prevention of drug related problems. Fourth, documented systems on patients' record, need and care. Documented systems on patients' records, need and care. Then offering continuous care in the systematic way. Then sixth one, taking help of other healthcare providers in integrating the care provided. Then seventh one, highly accountable and responsible. In eighth one, optimizing patients' health quality of life. Then basic elements of pharmaceutical care is 8 points. First one, patients originated. Second one, both acute and chronic problems addressed. Third, stress on preventions of drug related problems. Fourth one, documented system on Patients recorded needed and care. Fifth one, offering continuous care in the systematically way. Then sixth one, taking help of other healthcare providers in the integrating the care provided. 7. Highly accountable and responsible. Emphasis on optimizing patients' health quality of life. Then functions of pharmacists to perform collections of the patient's data. First one, collections of the patient's data. Second one, identifications of problems. Third one, establishing outcomes goals through a good therapeutic plan. Fourth one, evaluating treatment alternative by monitoring and modifying therapeutic plan. Fifth one, individualizing drug remains. Then sixth one, monitoring outcomes. Collection